Hello everyone. Today we will discuss about ganglion cyst in the short note series. A ganglion is a common benign swelling that arises near a joint or a tendon sheath. It is most often seen around the wrist, especially on the back of the wrist. Though harmless, it often worries patients because it appears suddenly and may fluctuate in size. A ganglion cyst is non-neoplastic cystic swelling filled with a thick jelly-like fluid arising from joint capsule or a tendon sheath. The exact cause is not clearly known. The commonly accepted explanations include degeneration of connective tissue near the joints, herniation of synovial lining, increased intraocular pressure forcing the fluid forward, repeated minor trauma and joint strain are believed to contribute it. The commonest sites include dorsum of the wrist, which is most common, volar aspect of the wrist, ankle and foot, knee joint, that is near cruciate ligament, tendon sheaths of the fingers. The cyst wall is made of fibrous tissue, no epithelial lining in this one, and contents are clear, gelatinous, and rich in hyaluronic acid. The clinical features include painless, smooth, round swelling, firm or cystic in consistency. Size may increase with activity and decrease at rest. Skin is free and not inflamed, usually non-tender, and may cause discomfort or weakness during the joint movement. Well-defined swelling near joint and does not move independently of the joint. Transillumination test is positive. Usually neurovascular compromise will be there. The special tests include transillumination test and movement with the joint. Differential diagnosis can be lipoma, sebaceous cyst, synovial cyst, rheumatoid nodule, giant cell tumor of the tendon sheath. Usually it is a clinical diagnosis, ultrasound for cystic lesion, and MRI is useful in deep or recurrent ganglia. The conservative treatment is usually the first line, where there will be reassurance because many resolve spontaneously with rest and splinting and sometimes require aspiration when there is high recurrence. Excision of the ganglion with its stalk is the surgical option. It is indicated only when there is pain, functional limitation, cosmetic concern, or recurrent ganglion. Complete excision reduces the chances for recurrence. Complications include recurrence, injury to nearby nerves or vessels, infection, though it is rare, scar information. So to summarize, the commonest site of ganglionic cyst is dorsum of the wrist. Contents will be jelly-like fluid with no epithelial lining, transillumination positive, and treatment of choice for recurrent surgical ganglion is surgical excision. I hope you learnt from this presentation. Thank you for watching.